So psychiatrists, as a profession, have started around 200 years ago, and there are now 200,000 psychiatrists worldwide. But the recruitment into psychiatry is declining, and it's quite clear that in most countries, fewer and fewer students go into psychiatry. And so the question is why? Are they not needed anymore? This is not true. All forecasts show that psychiatric services will be needed, but psychiatry may not be able to fulfill these needs. So the question is whether this decline goes on, we might disappear in 50 or 100 years.
Would you elaborate a little more on the challenges, both internal and external, on psychiatry?
Yeah, the World Psychiatric Association's president, Professor Mario Mai, has set up a few working groups and also has asked me to perhaps look through the literature for possible challenges to the profession, why this decline is occurring. And so I identified 6 specific challenges. There are others which concern also other professions, like economic challenges and restraint of financing or cost containment and so on. But there are 6 specific challenges to psychiatry as a profession. And I have grouped them into 3 from inside and 3 from outside, so to say. From inside, there is increasingly doubt about how valid our diagnosis and our classification really are. And we can see this in the fact that ICD-10 and DSM-4, our diagnosis systems, have not been changed since a long time, whereas in the beginning, every 5 or 10 years, there was a change. So why has this change not occurred? Because people are thinking whether this approach is correct we are using or not. And there are discussions now not only from outside, like anti-psychiatrists have always challenged diagnosis, but also from inside in the process of reforming and restructuring our diagnostic systems. The second point is that quite a few therapies are being challenged in their validity. So this is especially true in pharmacotherapy, where recently real-world studies have been published which seem to contradict previous smaller clinical trials, where, for example, it has been shown that the old antipsychotics were not less efficacious than the new ones. They may have more side effects. But also other developments have occurred that it has been quite clear that there was selective publishing in antidepressant trials, for example, that studies with positive results were more often published than those with negative results. And this has been made public worldwide, also in the general press, and people are somehow losing confidence in our treatments. But it's also true for psychotherapeutic interventions as long as they relate to psychiatric diagnosis. If diagnosis is not so valid, so do we have a treatments for these not valid diagnoses? The third threat from inside is something which is around since a long time, but which is now being accentuated with the progress in modern neurosciences. The subgroups within the profession, the older you get, the more you go into one direction, either to biological psychiatry or to psychotherapy or maybe to social psychiatry, and you always go to conferences just for this, you read the specific journals, you do research like this. And also these subgroups get increasingly harsh with each other, calling them each other mindless or brainless, for example. And the question is whether this basic knowledge will lead to a split up into something which someone has called brainiatry and another group which is called psychotherapy. There are also 3 challenges from outside, more than ever, and one reason why this is occurring is also that communication worldwide through the internet is increasing. So one challenge is that patients and family members are increasingly criticizing psychiatrists. You see it also that they don't accept the word patient anymore. They say client, consumer, user of services, ex-user, even survivor of psychiatry. And so criticism of psychiatry is growing in the internet, and we have to cope with this. We have to go into this also. The second challenge from outside is that so many other professions are intruding into our field. Not only psychotherapists, but also neurologists, let's say they take dementia, epilepsy, or whatever, and say everything is a brain disease. But also that psychologists, for example, are allowed in some states of the United States to prescribe medication, which is the proper field of medicine, so to say. So other professions are coming up and doing what psychiatrists have done so far. And there has to be a discussion of this, and we have to cope with this and see whose task is what. Solution might be teamwork, whatever, but it's a difficult topic. And the last one from outside is that still the image of psychiatry in the public is not as good as some of us might think. We are still regarded as a somehow strange profession, also from other medical doctors. And studies show that students in England who have started to become, to go into a training for psychiatrists have stopped because of this negative image. So they didn't want to get this negative image from other doctors, from other disciplines. So the question is what we do with all this. Since, as I said, the demand for psychiatric services is increasing, we shouldn't be too pessimistic that we are of no use anymore, but we should rethink the professional profile. I think there are a few ingredients which we should put more emphasis on, like the comprehensive clinical experience with all types of disturbances, which we have in our training, which no other profession really has. Knowledge about psychopathology, which they don't have. And then also skills about communication with patients suffering from mental disorder of any kind. I mean, neurologists, I don't say they don't have skills, but they rather look at the patient as its brain and look at the image. So we have skills from our training in communicating, which other professions don't have so much, I think. Finally, I want to stress that large professional organizations like the Royal College of Psychiatrists in England or the European Union of Specialty Doctors with its psychiatry branch have now launched discussions about the new profile of, as they call it, a general psychiatrist who should reunite. Whether they are successful, we'll have to see.
And would you also address the current trend in psychiatry, which is the integration of biopsychological, social, and even the spiritual dimension of psychiatry?
Yes, this is often just a lip service. And the older you get, the more you are not able anymore to cover everything. With the specialization and the demise of the generalist in modern society, not only in medicine, we know a similar problem as psychiatrists have general practitioners, primary care doctors. In the United States, fewer and fewer students are going in primary care because the status of the generalist is declining. So with all these pressures from outside also, bad status of the generalist, it will be very, very difficult to keep everything together and to actually live the biopsycho, social, and spiritual model. How this can be done, I'm not sure, but we have to try to do.
Thank you very much for the interview, Professor.